Hi everyone, good afternoon. Welcome to the webinar. I'm Prath from the Content and Partnerships team at TYHO, also known as TYHO for short. Joining me today is one of our expert TYHO therapists, Punitha, who's on screen here, who will also be leading the session today. For those new to TYHO, I want to quickly introduce ourselves before we get started. TYHO is an end-to-end platform offering quality mental health support. This includes online sessions globally and in-person sessions in Singapore. We started these AMA webinars in response to requests from our clients. A lot of you wanted us to host talks around everyday mental health issues, including postpartum mental health. And that's why today's topic is on postpartum blues, what every new mom and partner should know. With better screening, new moms are finding out that what they're experiencing could be more than just baby blues, something that really affects their day-to-day life, happiness, and even relationships. So we thought it was really important to have these conversations and to help you figure out how to make sense of this new chapter in your life. Just a couple of quick notes. The webinar will start with a presentation by Punitha, followed by a 45-minute Q&A segment at the end. Feel free to post your questions or share your experiences anytime in the chat. We will try to address as much as possible. Lastly, at the end, we'll also share a feedback form with you. Your responses are really valuable to us in making future AMA sessions better. Now, I would like to introduce our speaker for the day, Punitha. Punitha is an individual and couples therapist at TYHO with over 10 years of experience. She is also a full member of the Singapore Psychological Society, or SPS. She helps clients with things like emotional regulation, marriage preparation, couples conflicts, counseling, caregiver stress, and more. As a working mom of two, Punitha really understands the struggles that many of you may face here. She knows what it's like to juggle different roles, right? Like being a mom and also being a full-time employee, and how all of this can get really overwhelming. So without further ado, I'll hand over the stage to Punitha.
Thank you very much, Prof. Just give me a few seconds to share my slides.
Sure. Let me stop sharing mine.
Is everybody able to see the slides?
Yep, you can see the slide.
Thanks, Prof. Thank you very much, everyone, for being here today. Good afternoon. You may be a new mom who may be expecting a child soon, or some of you may already have a child. It may not be your new child. It may be number 2 or number 3 even. Yes, or some of you may be moms to be as well. And I hope that today's discussion can help us to talk about all these different aspects, right? I know the topic is about new moms, but I think that with every child that we have, there's definitely different challenges that we face along the way as well. And I guess today what I want to do is to maybe help us to start having these conversations about maybe normalizing some of the challenges that moms face, because I feel that sometimes maybe the odds are pretty much stacked against us. There are so many expectations that come in as a mom. So I'm a mom of 2 kids. My kids are pretty big right now. They're 14 and 12. But definitely, I still remember the days of being a newborn mom, right? Or at least being a mom of 2, at least at that point in time itself. Yeah. And what we're going to start on today is that we're going to talk about 3 main areas, and later on, we'll definitely take questions as you guys come in. We're going to talk about the life as a postpartum mom, what reality is. One of the things that we always hear is about how life changes as a new mom, right? And this can create a fair bit of fear and anxiety for us. Or for those of us who have already had our child, it's this loss of the previous life that we've had, isn't it? And sometimes we want to reclaim it so much. But because of all the responsibilities that come with it, that can be really hard. we want to start looking at how can we help, right? What are the things that we can start doing for ourselves as moms to be able to self-care a little bit more? And maybe what are some societal standards that we need to shift away from to be able to help moms actually function better, right? I also want to acknowledge the partners who are here today. I think that's very important. And thank you for being here to support your wives as well. Yeah. And so, let's start with some facts, right? And sometimes maybe this is the unseen part of it that we don't see enough of, unfortunately, right? Which is that actually 80% of women do experience some type of mood disturbance or postnatal blues, at least within the first month of giving birth itself. Yeah. And so when we talk about postpartum depression, usually it's a little bit more prolonged. But postpartum blues, which is basically your mood disturbances, do come in for at least 80% of us. They are typically mild symptoms, but it's there and it may be short-lived. But this is also depending on the support that we have for ourselves. Now, some of the times, we hear people say this, right? It's just hormones, you need to get over it. It will be perfectly fine. You being irritable, you being upset, you crying, it's something that you will get over after the first month or two. But that's not actually true, right? Hormones may tip the scales. Yes, postpartum hormones are normal, but it is actually often the accumulation of stresses, right? Whether it's the emotional stresses that you're going through, physically, just the act of giving birth itself, it takes such a physical toll on our bodies. And then the environmental stresses, right? Having to look after a newborn, now you have a life that is basically pretty much dependent on you, isn't it? Right? And the anxiety and fear that comes along with it that can actually weigh very heavily on moms. Yeah. Which is why the understanding, support, and care from the community then becomes really very important. Now, 1 in 5 pregnant women experience antenatal depression, meaning that when you are pregnant itself, sometimes you do start to experience some symptoms of depression. And again, this is something maybe that goes underdiagnosed because it can mimic normal pregnancy symptoms like fatigue, your appetite changes, your sleep issues, right? And as a mom, sometimes we know that this happens when you're pregnant itself. Baby may be kicking, sometimes you have a bit of heartburn, and all this causes sleep issues. But if we don't get this diagnosed early enough, sometimes after we give birth, there's also an increased chance of it continuing on itself. Yeah. And without support, it increases the risk, of course, of postpartum depression, strains in the relationship, and even developmental changes for the baby itself. Now, lastly, 10 to 15% of women, right, apart from postpartum blues, they go on to develop something more severe, which is the postnatal or postpartum depression symptoms itself, with significant symptoms of depression, anxiety. And today, what we are also going to be doing is we're going to start looking at the symptoms, which actually pretty much mimic your depression symptoms, but we're also going to look at risk factors itself, what puts us at risk. But let's start with actually identifying the differences between baby blues and postnatal depression itself, right? For baby blues, basically just the initial period of giving birth and being able to go through such a strain, it occurs within the first 2 weeks post-birth, and it resolves within a few weeks to a month after we give birth itself. It can affect up to 80% of new members, and this is actually based on research that was conducted in KKH in Singapore itself. Yeah. The symptoms that we sometimes may experience are mood swings, irritability, tearfulness, anxiety, we are overwhelmed, which is understandable because a lot of the times as a new mom, one of the biggest challenges we face is the lack of sleep, right? How do we even function when we are getting maybe 2 to 3 hours of sleep, right? And this is disrupted sleep. Generally, the symptoms should be mild and come and go throughout the day. And with self-care activities, being able to look after yourselves a little bit better, family, social support, and reassurance, it can be managed more effectively. Now, what we want to start to recognize is that postnatal depression, like we mentioned, actually can affect up to 10 to 15% of new mothers. At least this is the data in Singapore. Globally, we have found that at least 20% of new mothers can be impacted. Now, this is a little bit more intense in the sense that it involves more persistent, so chronic feelings of sadness, emptiness, hopelessness, this loss of interest in previously enjoyable activities, and it starts to functioning itself. Yeah. And with postnatal depression, it does require professional intervention such as therapy, counseling, or even medication. Now, but I want to say this, right? I think a lot of the times we are very worried about taking medication for postpartum depression. And to be honest, this is normal, right? But at some point, we start with at least getting the help that you need, right? If you feel that, after a month of giving birth, these feelings of helplessness are not going away, it's actually getting worse or it's seriously increasing, and maybe at least starting with therapy or speaking to someone or getting into a support group may be a good option. The medication option can come later, but this is what I think, and this is something we can talk about as well, right? If we know that the symptoms are starting to increase, sometimes, yes, we are worried about side effects, but taking medication can maybe be an option that can help to at least lift your baseline mood so that you're able to function. And it doesn't have to be chronic medication, meaning you don't have to be on long-term medication, right? There are medication out there, antidepressants that are safe for pregnant women and for mothers who have just given birth as well. That's safe even if you breastfeed. Yeah. Now, so life as a postpartum mom, what does that look like? It is basically, we start with the physical recovery, right? We spoke about the sleep deprivation, yes. And this is something that is absolutely normal, isn't it? 1 to 2 hours to feed our babies, right? And sometimes it's not as easy as just falling back to sleep, isn't it? Right? Sometimes you may feel that you need to clean up after baby, right? You need to make sure that baby is okay, baby has burped, right? And then the pain itself from the delivery itself, right? The hormonal shifts makes physical recovery a lot harder as well. The emotional shifts, basically the baby blues, which is very common, but sometimes even the depression and anxiety. As a mom, not just as a new mom, right? We worry so much about the health of our child, right? And there's a lot of shoulds and coulds that I think come our way as well. That these are the things we should be doing for our child. These are the things that we could be doing a lot more of, whether it's our own expectations or expectations that people around us may have. Yeah, and we can talk a little bit more about that later. Identity changes, right? And this is something that happens, which is a loss of former self, right? In the past, something as easy as going out is a very simple task, right? You get ready for yourself, you're responsible for yourself, you go out the door, right? Now, when you have a child, even the task of going out can be very difficult because you need to have a diaper backpack. Just as you're leaving the house, something happens, right? Maybe baby spits up on you, right? Baby poops. And all these things, makes you infinitely more difficult to leave the house as a single person anymore. The new roles and responsibilities that come together as well as a mom, right? It's not just about ensuring baby's health, but it's all the mental load that comes together in pooling all the resources you need as well. I think a lot of moms, what we also experience is this social isolation. Many of us feel very unseen or judged. Again, if you think about it, right? The community expectations, breastfeeding versus formula feeding, right? Vaginal birth versus a C-section birth, right? We talk about all this, moms who do it all on their own. We glorify moms who do it on their own versus getting the support that they need, right? Whether it's a confinement nanny or a helper, even. And these are the postpartum depression symptoms that we want to start to acknowledge that actually do exist. And we want to start to help people to identify it's there, right? And actually, I think this is something that needs a lot more awareness, not just for the mom and their partners, but from family members itself, right? That this is a reality. Maybe even from people who are supporting the community, like our confinement nannies, right? They are usually the ones that are with the mom, day and night in the first month, especially if you've engaged one. I think this psychoeducation is very, very important in terms of understanding emotionally. For moms, there's a lot of anxiety about what's happening with baby, right? There's a lot of mood swings. There's this feelings of worthlessness. There's always this question, am I doing enough? Am I a good mom, right? Can I even be a good mom, right? And there's a lot of guilt as well, right? Why can't I do these things for my child, right? Or why can't I do it alone even? Physically, definitely the fatigue, the sleep disturbances, and changes in appetite and physical aches or pains are something that do start to come in terms of the depression symptoms. Behaviorally, the loss of interest in activity, while sometimes it may be possible that our life changes as we have a new child. Maybe previously you used to be someone who's very physically active, you could go for a run, right? But right now, maybe it's very, very difficult, right? You don't even feel like doing those things anymore. These are things to start making note of. Are you withdrawing from friends and family who are trying to reach out to you, right? Or do you feel that you're having difficulty bonding with your baby, right? Do you feel that there isn't a connection? Or that sometimes for mothers, it can be very difficult. Certain babies can be a little bit more challenging in behaviors, meaning that they are more difficult to soothe, right? Or sometimes they're crying all the time and it makes us feel very helpless, isn't it? Cognitively, I think it's also about this mental fog, the difficulty thinking clearly. We cannot focus, we have trouble making decisions and maybe even remembering things. while part of it can be normal, if this becomes a continual pattern, then these are things that need to be recognized early on as well. Lastly, I think this is also very important, right? If the mom or someone you know is starting to express thoughts of self-harm or harming the baby or thoughts of harming self, these are things that automatically means that there has to be some help that needs to be brought in for them itself. You know? And so risk factors, again, these are risk factors, while actually there isn't, so what actually happens is that every mom can be at risk of developing postpartum depression. So what it means actually is that even if the mom has a community of support, right? Even if the mom is breastfeeding, you think that they're doing great, it doesn't mean that they cannot develop postpartum depression. Sometimes it can just come in, it creeps in very normally. But these are also some risk factors to start recognizing, right? When you are in the midst of pregnancy or even as you have given birth. One is if you have had a history of depression or mental illness, right? It actually makes us more susceptible to negative emotions associated with postnatal depression. Now, number two, I think this is something that maybe we don't talk about enough, which is the past upbringing or difficult relationships that we have with our own moms. Yeah. Women who have had a tough relationships with their own mothers as children may actually carry a lot of emotional baggage into motherhood. A lot of the times we may think that, I don't want to do things this way. I don't want to do things the way that my mom did. And we shift a lot away or very intentionally do a lot of things that means I don't want to do these things. But it can exert too much pressure on ourselves as new moms, which actually leads to heightened stress and a higher risk of depression as well. The third is having complicated pregnancies, right? So for women who have had a more challenging pregnancy, who has maybe had difficulty conceiving and now you're pregnant, right? Maybe it's also about having a rainbow baby, right now. So after a miscarriage and you're having a baby right now, there may be a lot of anxiety and stress that comes in, as you have given birth as well, because right now you're more worried about the welfare of the child, right? And I think these are also acceptable needs or acceptable concerns that need to be spoken about as well. Yeah. For women who have gone through assisted reproduction, such as IVF or IUI, it can actually make the baby more precious to the mother, right? Which also increases our concerns about potential complications during childbirth. Yeah. Lastly, it's premature birth and the NICU stays. Mothers of premature infants, particularly those admitted to neonatal intensive care units, they often grapple with anxiety and depression due to the intense worry that they have about baby's health and treatment. And lastly, one other risk factor is social factors. So single mothers, right? Those facing financial challenges, individuals with many children, right? When this is baby number 2 or 3, you are juggling so many things. You're juggling a newborn, you're handling your other 2 children, for example, right? And when you don't have the support that you need, it also puts us a little bit of a higher risk as well, right? When you don't, maybe your spouse is not as supportive or your spouse is busy at work, or when the whole family unit experience increased stress in caring for a newborn, it also elevates the risk of postpartum depression. Now, what can we do, right? And these are the couple of things that maybe we can talk about a bit. The first thing is sleep, right? I would really say, you don't need to do it all. If the baby naps, please rest instead of catching up on tasks. Even 20 minutes of quiet time can actually help us to reset. And rest isn't laziness, moms, right? It's actually a survival, right? We do need to be well rested to be able to look after our child as well. Yeah. And unfortunately, you may hear this from well-meaning adults in your life, other people in your life who says, oh, when baby is sleeping, that's when you should be catching up on chores. That's when you should be cleaning. That's when you could be doing everything and making use of your time. But I don't know if it's practical. I think if you're exhausted, please rest, right? If you have someone who can help you, please tap on that as well. Secondly, it's also about setting boundaries gently but firmly. There may be people in your life that may have a lot of expectations of you. It may be your own expectations itself. But for example, with work, you need to set expectations in terms of, what are your availability basically, right? If you're checking emails while bouncing a baby on one arm, it's actually too much. Try setting, on and off times for work tasks and to use auto responders if needed, right? Now, in-laws, if they're adding stress, you need to let your partner know, and be the messenger, right? Sometimes it's good to say, we're still adjusting and we need some quiet time right now. Thank you for your understanding, right? Sometimes we need to be able to set certain boundaries that helps us to be able to manage. The next is about lowering the bar, right? Sometimes we also need to recognize that our own expectations, are they coming in place, or at least are they contradicting with what we really need for ourselves, right? Sometimes as moms, we expect that we have to be perfect. We need to be able to be the super mom principles, right? And we'll talk about that in a bit. Yeah. But sometimes we need to recognize that certain struggles are normal, right? The fact that you get frustrated maybe when baby keeps crying, right? And you cannot soothe baby. Sometimes this can be very difficult. And I experienced that a lot with my younger daughter. She would only be soothed if I carried her, right? And that lasted up till about 3 to 4 years of age. Yes. And these are things that sometimes can be very hard because if you have a more clingier baby and no one else can self-soothe her, it creates a lot of stress on the mom themselves. Yes. The other thing is also thinking about, is this urgent, right? Do these household chores need to be done now? Do these tasks need to be done now? Or actually, do I need to prioritize myself or what I need at this point in time? Please do try to outsource or accept the help that you need, right? Whether it's meal delivery for a few weeks, so that it actually takes the task of cooking healthy meals for yourself out of the question for a bit. Whether it's a friend watching the baby while you can nap, and you know that at least the baby is in trusted hands, right? Letting a coworker take something off your plate. And I think sometimes we really have trouble asking for help, right? We're not weak for needing help. I think we're actually wise for being able to accept it because we need to look at what we need at this point in time as well. Creating micro moments for ourselves then also becomes very important. Even 5 to 10 minutes a day to breathe and listen to a song you love, to drink tea or coffee alone, or step outside can feel like a reset, right? It doesn't have to be dramatic to be meaningful. Sometimes we think self care means we need to get out of the house for an hour. If that is not possible, to be honest, having a routine to be consistent about 5 to 10 minutes. I hear so many moms telling me, right? And this has happened to me as well. I don't even have time to take a shower. I don't even have time to drink a cup of coffee for myself, right? Or we make a cup of coffee and then baby starts crying and then the coffee gets cold. Yes. But I think it is important to be able to set aside at least 10 minutes a day that we have time for ourselves. Lastly, talking it out, right? Whether it's a therapist or a new mom support group or a friend who gets it, voicing your feelings do help, and you may be surprised how much relief comes from just being heard itself. Now, talking about the shift in culture, I think one of the things that we definitely need to change very much is from supermom ideals to realistic supported motherhood. We hear this narrative, right? Gosh, she's doing it all. She's going to work, she's managing her baby, she doesn't have a helper, she's doing everything on her own. But is this realistic, right? We know that it takes a village to support a mom, right? And we should start to recognize that this supermom ideal may actually be pushing a lot of unrealistic expectations. Sometimes as moms, we hear this, right? You should be grateful and happy all the time, right? Just because you're conceived, you have a baby right now. But when you're feeling sad or upset or frustrated or angry, even, our feelings tend to get minimized, right? It's almost like you should be happy and appreciated for all you have. But that may not be the situation, right? There may be a lot of other factors that come into place that prevent us from feeling that way as well. Lastly, and I think one very, very important part is also how partners or family members can help. Yeah. And this starts very much with starting with empathy and not solutions itself. Yeah. Which basically means, it's asking moms, what do you need at this point in time? It's listening to them, right? I think as for partners, I don't think that moms don't know what to do sometimes. It is more of just feeling validated and heard, encouraging small breaks and care without pressure, right? Just telling the mom that don't worry, go and have a shower, right? Take the next 30 minutes off. I've got it, right? I will put baby to sleep. I will do whatever it needs to soothe baby for now. Don't worry about it. I've got it, right? And being able to follow through on that makes a lot of difference to the mom to know that you are lightening her mental load. Affirming and appreciative mom. I think one of the biggest things that moms struggle with is the mom guilt, right? And feeling like we are not doing enough. And I think that's why validating your partners, right? Being able to appreciate the things that they're doing. Yes. Thank you for trying to keep the house clean as you're trying to look after baby, or thank you for just, putting in so much effort with baby, even though they've been sick and they've been crying. And these are things that we need to recognize a little bit more of as well. Yeah. And lastly, I think lightening the load means lightening the mental load, which means taking on a task from start to finish, right? So it doesn't mean just asking your partner, what can I do? But it means actually you taking the initiative to say that, what, these are the things I will handle, right? Whether it's all the grocery items, I will handle it from start to finish to ensure that all the groceries are ordered for this month, right? Or it could even be saying that, hey, don't worry, for just 1 hour, I'll bring her out every single day. I'll bring baby out, sorry, right? For every single day and make sure that baby is okay while you rest and you do whatever it is that you need to in that time. So it's almost like saying, I've got you, don't worry too much at this point in time. Yeah. And I think now we can move on to the Q&A. Yes.
Yeah, thank you so much, Punitha. That was very interesting. I particularly loved the points about, the societal expectations on new moms and also the super mom.
Right. Thank you, Prash.
Yeah. Let me quickly share my screen before we move on to the
Yeah.
Q&A section. Okay, now we move on to the Q&A segment. Before that, just a quick note to respect each other, keep an open mind, and also to stay on point. You can drop your questions in the chat box or feel free to unmute yourself if you'd like to speak up. That's all I have. Please feel free to ask away.
I see that Shelley has a question. Thank you, Shelley, for the question. Yeah.
Let
And
me
so,
read out the question for
yes,
everyone's
thank
benefit,
you, Praf.
and
Yep,
then Punita, you can answer accordingly.
sure.
We have a couple coming in already. So the first one goes like this. Thank you, Punita. The burden of judgment feels a lot sometimes, and there's a lot of conflicting advice that adds to confusion and frustration. How can we manage this?
That's an excellent question, Shelley, right? Sometimes we get a lot of this advice from very well-meaning people, especially I think from maybe the elder generation, right? Our in-laws or our parents who may have done it, or sometimes they feel that they have done it better. Yes. But I would go with this, right? I think as a mom, we always have a gut instinct for what our child needs. And I would suggest that we manage with that, right? So for example, if in-laws or parents feel that this is something that needs to be done for child, but you feel that this is not, maybe it's something to have a conversation around, right? That maybe at this point in time, I don't feel ready to take this yet. I do hear your suggestion, but this is what I would like to try for my child and consider this first. Yeah. And I think it's also very gently setting boundaries about what you want for your child, Shelley, right? And I think this is important, right? A lot of moms, we come into having a child preparing for what we need to do, isn't it? Right. And we may already have some knowledge on it. But you're right about the confusion that comes in. It makes us even doubt our own thoughts as well. Yeah. But I would say that go with what you feel that you want to try, right? What is your instinct telling you? And based on whatever you have read, right? And I think that's what a lot of us do. We turn to Dr. Google to rely on information. Yes. But I think sometimes it's really about what you think is best for your child. I hope that helps.
Yeah, that was very interesting. So I think the takeaway is to have clarity in thought and to, kind of like shut down the noise before.
Yes. And to trust your judgment, right? What do you want for
Mhm.
child? Yes.
The next question is is about a person who wants to support their friend. So I'll read out the question first.
Sure.
How to provide support for a friend who's going through severe baby blues. My friend has been showing some alarming thoughts, such as, I'm afraid I will hate my baby because giving birth is painful. I tried reminding her how important and noble it is taking a role as a mother, but I'm afraid it will become a pressure instead of a reassurance. What kind of sayings do you think I can provide my friend for this?
Right.
So
Thank
I
you,
think
Bridget.
this is
Sorry.
more about how to initiate conversations with other people without, hurting them or without saying the wrong
Yes.
things.
Absolutely. Thank you. No, and that's a very good question, Bridget, right? And this is a very valid concern, isn't it? Especially for new moms, right? There's a lot of fear with birth, or even for some of us who may have had a more complicated pregnancy the first time round, isn't it, right? We are so worried about the birth process itself and how painful it can be. And I think maybe it also starts with validating moms, right? That yes, actually, the birth process can be painful, right? Depending on what the mom wants, right? A lot of the times, as moms, we think that we cannot take any painkillers when we are trying to give birth, isn't it? Right? We think that basically we have to have painkiller free, non-epidural delivery. But I think it's also about recognizing and validating and asking mom, what are you really worried about in terms of giving birth, right? If the pain is a concern, is mom willing to consider the painkiller options, right? There's actually a lot of research, into epidurals, right? Epidurals really do help, and yes, I know that there's a lot of worries, in terms of the impact that it has on your body later on. But please talk to gynae about this, right? Yes, giving birth can be a painful process, but I don't think that, and this is what my gynae also said to me, that we shouldn't be torturing ourselves, right, to give birth just because we feel that we need to be painkiller free, right? Epidural free, basically. And I would say, Bridget, maybe one of the important things is that we validate her, yes, but maybe it's also exploring painkiller options for her. But maybe it's also recognizing that we take it one step at a time, right? We don't want to dismiss her concerns. If that does happen, where maybe she feels resentful of baby, then that's something that perhaps we need to attend to after she has given birth as well. And it is a valid concern. But I think it's also about recognizing, right, that who she is as a person, right? And I think that as moms, we surprise ourselves sometimes, isn't it? For this infinite ability to love and care for our child. Yes, but at times, yes, we do have some frustration and anger that sometimes is valid. And talking about that maybe can be the most important thing.
Thank you, Punitha. Just to quickly address the second part of the question, do you have any tips on what this person can say, like dialogues or any sayings that they can bring up to their friend?
So I would start with just saying, I think it's a very valid concern that you have, at least in terms of giving birth. Giving birth can be a painful process. Do you think that it's okay if we could have a conversation, right, about the pain that you're worried about, right? Are you okay with taking painkillers, for example? What are your worries about taking painkillers? Yes. What would a less painful delivery option look like for yourself? How can we facilitate that together with the gynecologist as well, right? Based on options that are open to the mom as well. Yeah.
Thank
But
you.
maybe it's just also letting mom know that even if after birth, if you do feel that, you are upset with baby or angry with baby, you can talk to me about it, right? Again, I think sometimes we think that as mothers, we should be angels, right? We cannot be upset with our babies, we cannot be frustrated with our babies. But I don't think that's true. I think it's also important to recognize certain conversations that it's okay to be frustrated at times, yes. And maybe having a valid outlet without being judged can be important as well.
Thank you, Punitha. Here's our the next question. We have this from a partner who wants to help their wife. So this is how the question goes. My
Okay.
wife recently gave birth, and I've noticed she's been more withdrawn and tearful. I want to be there for her, but I don't know what she needs or how to support her emotionally. What can I do to be a better partner during this time?
Right. Oh, and thank you very much for the question. And I think this is an excellent question. Yes. I would start with maybe just acknowledging and validating what's been happening for the mom. I think I would say something like, it sounds like things have been quite difficult for you, and I just want to hear you out. What's been happening? What can I do? How can I support you at this point in time? Just being able to recognize that, perhaps having this conversation with his partner then becomes very, very important about what she needs from you at this point in time. Yeah. Sometimes, having this conversation can be helpful, but if maybe wife is not ready to talk about it yet, maybe it's about looking at, okay, other ways that how can we help to lighten her load? Yeah. Which is, does she need a little bit more sleep, right? So sometimes it's good to start taking note of the physical symptoms for her. Has she been able to sleep well? Has she been able to eat well, right? Are there things that maybe she used to do in the past that she would like to do now, but maybe she experiences a lot of guilt from being separated from baby? And is it a possibility to offer her that time, right? Whether it's going for a yoga class, for example, right? Whether it's going for a massage, for example, that maybe can support her in what she needs. I would say definitely have that conversation and validate wife's experience, right? That it seems like it's really hard for you, right? How can I help you? What do you need from me? Yes.
Yeah. So I think it all starts with sharing space first or giving space to the other person. Checking in, like, do you need something from me or can I just do something to you? Like, can I help with something? Both
Yep,
voluntary and, something that the other person actually needs help with.
that's right. And maybe it's even just telling mom, right? For example, something along the lines of, I really want to be more involved. I'm worried about you, right? And I know that things have been pretty rough lately, but I want to learn, to share the load, right? What's been hardest for you lately? And this is just about recognizing that it's hard, right? We are not minimizing or dismissing mom's experience in any way.
Thank you. Moving on to the next one. Winter says that the seminar was very interesting
Thank
and
you.
also would like some advice as a first-time mom. So his other question goes, I barely have time to eat or sleep, let alone take care of myself. Whenever I try to rest or do something, I feel guilty. How can I start prioritizing my own well-being without feeling like I'm being selfish? I used to be such an organized person, but now I'm unable to have any work done, and it's taking a toll on me. So I guess
Thank you.
this is about the feelings behind rest, right? I mean, we all feel guilty to some extent when resting, especially, I'm sure, new moms. So what advice would you have for this person?
Yes, thank you, Winter. I think that this is really a very, very good question, especially because I think this mom guilt is very, very real. We all struggle with the fact that there are things that we feel, or we feel that 100% of our time, or maybe even 150% of our time should be with baby, right? And that we cannot do anything for ourselves. And I know this is a bit of a cliche. We always hear about this happy mom, happy baby. I think that is very, very true, Winter, right? Only if we look after ourselves can we look after our child better, right? If we look at this, right, only if I get a good night's sleep can I actually be able to focus and pay attention and be present with my child the next day, right? And maybe these are the things that we need to start recognizing in terms of the narratives that we're telling ourselves, right? Is it really selfish for me to take an hour to sleep while someone else whom I trust attends to my baby? Because I think then we need to start looking at what is non-negotiable in terms of rest for moms. Yeah. I think maybe a lot of the times we wear this badge of honor, right? Or we hold this trophy about how we need to do it on our own. We need to be super moms. People talk about, oh, I only had 2 hours of sleep yesterday. Oh, you know what? I'm fully breastfeeding my baby, right? Oh, I had a vaginal delivery without any painkillers. Yes. But maybe it's starting to recognize that every mom is different, but we also need to recognize and prioritize that every mom needs to have that self-care for themselves. I hear the part about you saying that I used to be such an organized person and now I'm unable to have any work done. And I tell you, gosh, this is so normal. The mom brain, we call it, right? And I think we don't talk about this enough. But to be honest, if you think about it, right? Yes, you were an incredibly organized person before you gave birth. But once you've given birth, there are so many things that come your way, Winter, right? Whether it's just making sure that baby is eating and drinking their milk well, right? Baby is pooping well, right? Whether baby is clean, whether baby is healthy, whether baby is within the normal weight, and height range, right? There are so many other things, making sure that things at home are being done, right? Making sure partner is okay. Yes. If you have in-laws or parents that you need to look after, that's an additional load. If you have work, that's an additional load itself. Yeah. I think I want to recognize that just because you have a child right now, it doesn't mean that sometimes it has to be status quo. Maybe we need to start re-looking at our thoughts about what rest means to us. Because a lot of the times we don't rest enough, and maybe that's something we need to challenge a little bit more, I would say.
Thank you, Punitha. This actually reminds me of a quote that goes something like, love yourself like you would love a friend,
Right.
right?
Yes.
And I think that's
Yeah.
very important. It's a very important
Absolutely.
reminder. Thank you.
Yeah. Thank you. Sorry. I have one more question that someone sent to me privately. If I could just read that out. Yeah.
Sure, sure.
How should we get over the health anxiety we feel for our babies, anticipating when they will fall sick at infant care or school, etc.? And gosh, this is such an excellent question, right? This is the thing that we worry about, isn't it? And causes most anxiety for moms when our babies fall sick, right? But maybe this is also a part of it, I think. right? Is it a norm that babies will fall sick? Yes, right? We will do everything in our power, isn't it? Right? We try to give our baby vitamins, we give them the healthiest food possible. But the reality is that they will fall sick. And by falling sick, they're also building up their immunity over time. Yeah. And I think part of attending to this anxiety is also looking at what are the things that are within our control, maybe, Rika, which is the fact that, for example, are we able to look at, okay, what is the food and nutrition that I'm giving my baby? Is my baby within the acceptable, weight range, for example? Is my baby hitting the normalized developmental goals that a child should be hitting at this point in time? I think, to be honest, if your child is generally a happy, smiley baby, yes, sometimes maybe baby will fall sick, but we also want to recognize that babies falling sick is also part of the normative process for them to be able to build better immunity over time. And I know it's hard when they're in infant care because, babies fall sick there and your baby gets sick. And it also brings the household into turmoil, unfortunately, itself, right? Your childcare leave get disrupted, your work get disrupted, partner's work gets disrupted and stuff like that. Yeah. But I think it's also about recognizing, okay, what are the support systems in place that can help you if work is being disrupted a little bit too much, yes. Yeah. And to see if there are anyone else who can come in to help with looking after baby when they fall sick. But I will go back to addressing health anxiety. I think we all have that as moms, yes. And maybe it's also starting to recognize the what's within our control and what are the things that we are doing for baby to ensure that they have the healthiest life possible, as much as is within our control, isn't it? Yeah.
Okay, the next question is kind of health related, but I guess more about the parent themselves. So here's how the question goes. How do I deal with constantly having anxiety, especially during bedtime? I keep jumping up from my sleep out of fear that something has happened to my baby. My husband has validated my feelings by bringing her for a checkup to eliminate any doubts. But I'm struggling with even believing the doctor sometimes. This is causing me so much sleep deprivation that I can't fall asleep even after I finally put my baby to sleep. She finally falls asleep, but I'm struck awake. Then there will be some nights that I oversleep all my pumps and even baby's cries because I'm too tired.
Mhm. No, and I'm sorry that this is happening, Nicole. It really does sound like there's a lot of anxiety about baby's health, or maybe this fear that something may happen to baby if you're not vigilant enough. Yes, yeah. And I think it's also maybe important to address this anxiety, Nicole, right? Where is this anxiety coming from, right? What is perhaps exacerbating this anxiety at this point in time? Yeah. What are maybe the processes that both you and husband can put into place, right? It sounds like one of the things the husband has done, which is great, right? Which is to bring baby for a checkup to ensure that baby is okay. But again, I start recognizing the what's within our control. And maybe attending to this anxiety a little bit more may be very, very important. And speaking to someone, I think, about this anxiety is important because it's causing the sleep deprivation, right? It's anxiety about baby's health to the point that maybe if you're not able to function, I think that's something that perhaps needs to be attended to, maybe with a little bit more yeah, time if possible, right? Perhaps one, it starts with journaling this anxiety, right? Which is where is this anxiety coming from, right? Why am I so anxious about something happening to baby? Is it something that I've read, something that I've heard, or something that someone has said that's causing this anxiety, for example? Yeah, but I think that this definitely would be something that I would suggest talking to someone about because this anxiety is something that is starting to impact you a fair bit. Yeah.
Okay, thank you, Punitha. The next one is an interesting question. It goes like this. In the modern society, a lot of women give birth at a more advanced age, example, late 30s, early 40s, where post-birth recovery and hormone changes are a lot more compared to younger women. But people expect us to recover based on an average timeline, which was not the case. And at the same time, older women usually already have a career in senior management where expectations to perform are much higher. What is your advice to manage work expectations and recovery at the same time?
Right. And thank you for the question, Alyssa, right, which is a very valid one because I feel that you're right. Sometimes there's this comparison, right, with younger women, and you're right, younger women maybe bounce back a little bit faster in terms of recovery. But I think again, it's about starting to recognize and set certain boundaries for yourself, Alyssa, right? The what do you need becomes very, very important and non-negotiable, to be honest. Yes. Yes, you are right that maybe some moms recover faster, but is that the norm? I don't think so, right? Actually, I think a lot of us are actually pushing ourselves to recover faster than we actually are recovering at that rate, right? Which means that sometimes we push ourselves out of bed, even if we are physically in pain. And while some of it, yes, it's part of being able to work on the recovery process, some of it also means that we are pushing ourselves too fast, right? Which doesn't give our body enough time to rest. Which is why I think that honestly, and it's hard, right? Because especially when you've built up a career in senior management and expectations are high, but it also means that your career means a lot to you, isn't it? And it's very hard to give that up. But it's also about starting to recognize where are the boundaries that you want to set in terms of work. While work or people at work may have these expectations, some of it is also starting to recognize, right, for yourself, what's okay and what's not okay, right? And the same thing with recovery itself, right? I think that actually we should be giving moms and we should be opening up this conversation about how maybe even a month is not enough for a mom to fully recover simply because of this, right? Firstly, the first month when a child is born is one of the most difficult times in a mom's life because of everything that comes into the picture, the sleep deprivation, right? How challenging it can be with baby waking up multiple times during the night, whether you have a fussy baby, a colicky baby, right? Maybe you have a baby who wants to be soothed a little bit more. All these things means we need to be able to manage for ourselves, right? What's okay and what's not okay. And that's why the setting boundaries perhaps is important. I hope that helps to answer your question, Anissa.
Thank you. That was more about setting boundaries between, personal life as a mom and work. We have another similar question, which I think also relates to boundaries. It goes something like this. How do we manage visitors who wishes to visit, holding the baby, etc., while we as parents would like to prioritize rest, recovery, and settling down before that? I think the previous question was more about personal boundaries, like the boundaries you set for yourselves. But this one deals more with how do you set boundaries with others when you want to take rest, but then they want to hold the baby. How do
Mm.
you handle that?
Right. No, and that's a very good question, Shayna. I think that in this day and age, and I think it's a lot cultural as well, right? The moment that baby is born, everybody wants to come and visit baby, right? Everybody wants to check in on mom and dad. And maybe something that we want to perhaps also put out the narrative is that and I have friends who have done this and I fully respect them for it. And I think it's great, which is that, they've said that we're not ready to have visitors at this point in time. I'm really sorry, but both mom, partner and baby, we're still recovering and we would like to have a little bit more time for each other before baby, is ready to see other people as well. Yeah. And I think this is hard because it means having difficult conversations with certain people, but I think that maybe this conversation firstly needs to happen with immediate family members, right? Once we can set those boundaries and hopefully get a little bit of that buy-in, then when we set those boundaries, these are boundaries that they can help us to set with other external relatives as well, for example. Yeah. And I think this is the hardest part. Like, how do I tell my own mom or dad no? Or how do I tell my in-laws no, right? Like, please maybe give us a bit of time, right? But again, this is a very tactful conversation, right? Maybe it's partner speaking to his parents and you speaking to your own parents about, what do you guys need at this point in time as well. Thank you, Sheena, for the question. That was an excellent question.
Thank you, Punitha. That was also an interesting and insightful answer. We have around 10 minutes. We can take a couple more questions. We have another one that's similar to, how to help the other person manage postpartum. Um, so this is how the question goes. Me and my wife, we are new parents. I would love to help my wife with our baby related work, but it always feels like I am doing it wrong or getting in the way. I would love to help my wife, but that's not happening. How do I fix this? And how do we make sure we share our responsibilities equally?
That's an excellent question, Shikhar, and thank you for being here. Yes, I think it's always wonderful to see partners coming in to support their wives as well. And I think this is hard because I think as a mom, we have our expectations of how we want certain things done. Yes. And perhaps I wonder if it would be helpful to speak to wife about, as you are taking on certain tasks with baby, what are maybe wife's non-negotiable parts of that task being handled, right? So meaning that if you were to shower baby, what is the most important thing that wife expects when you're showering baby, right? And I think this conversation needs to happen about, okay, what are wife's non-negotiables? And do you have the leeway, everything else, as long as baby is safe and secure, are you able to do things within your own range as well, right? Or within your own initiative as well. Yeah. It may not be exactly as how maybe wife has pictured it, but perhaps having that conversation about that give and take, right? What does wife expect? Okay. Are you able to meet those expectations? If not, then having that conversation about, okay, is it okay if I do these things? But these other things, maybe, can I do it my way? And is that something that wife is okay to consider? Yeah. And I think this is hard, right? It is hard because I think as moms, very naturally, we have our own expectations, yes. But I think at least having that conversation about how can we meet halfway, yes, and how can we be able to help each other out as needed, yes. And I think it's excellent that you're trying to come in to share the responsibilities equally as well. Thank you, Shikhar.
So we have another question that kind of acts as a follow-up to the one that we just addressed. We spoke about how partners can, help the person going through postpartum. But now we have a question on how do I allow myself to accept more help? So I'm assuming this is someone who is going through postpartum. How do they allow themselves to get more help? The question says, I take shifts with my husband at night, but I always eventually take over soothing baby because I can't stand her crying. Or in the day when my helper helps out, I can't rest because I keep wanting to soothe her myself.
Yes.
What advice would you have for this?
Right. And again, this is very normal, right? I think as a mom, when baby cries, it's very difficult for us to not go and soothe baby immediately as well, right? And maybe something to also recognize is that um the other person also needs to figure out. So they may not be able to do it as best as you can do it, right? Maybe if you carry baby within 5 minutes, baby is soothed, right? But perhaps it's also giving husband the opportunity to take his time to soothe baby with a way that baby feels comfortable with her dad, for example, right? Maybe for yourself, when you carry baby, it's enough. Baby smells you, right? Baby hears your voice and they're comforted and they settle down very quickly. Yeah. But maybe with husband, it takes a bit more time. And that's the hardest part, right? You want baby to stop crying and sleep as soon as possible. But sometimes maybe it's also riding out this anxiety a little, Nicole, right? Maybe it's good to set a time limit, right? So for example, how long can we try to give husband at least maybe 10, 15 minutes, for example, to try to soothe baby on his own? Okay. And if you feel that, okay, really, maybe husband feels frustrated or you need someone to come in, then you can come in. But perhaps it's good to negotiate this with husband, right? At what point does he need help? Actually, does he feel that I can manage? You don't worry, I've got it. Or is there a tap out, right? Hey, I'm sorry, I cannot soothe baby right now. Can you take over? And it's the same thing with helper, right? Because again, it comes back to this, yes, Nicole, which is the rest for yourself, yes. And it's hard for you to get the rest, I understand, if baby is crying. But at some point, maybe in the daytime, if it's possible, maybe it's good for you to use that time to take a little bit of a walk, whether it's a 5 to 10 minute walk, or maybe to sit down and listen to music, or to do something else for yourself to help you to distract from the situation, just so husband and helper learn to deal with the situation as well, right? Or learn to self-soothe baby on their own. Yeah.
Okay, thank you, Punitha.
Welcome.
I think we can take one final question before wrapping up. So the last question says, I'm a new mom, and ever since my baby arrived, I feel like I've lost the person I used to be. I used to have hobbies, a career, and a sense of purpose. Is it normal to feel like I don't recognize myself anymore? I think you also covered this in your presentation when you were talking
Yes,
about identity change. But what
that's right.
advice would you have
Yeah.
for this person?
Oh, and I think that this is absolutely normal. I work with moms who come and share with me how it is so difficult for them right now. Maybe they used to be very physically active. They used to do yoga, they were a yoga instructor, and right now, actually, it is so difficult to get back to their pre-pregnancy body or pre-pregnancy energy, even. Yes. And I think this is honestly very, very normal. And that's why it's important to look at very small, doable steps for yourself, Sonia, right? And I think that, to be honest, a part of us changes, right? Maybe our priorities actually change when we have a child. Yeah. Maybe in the past, we would have enjoyed getting dressed, going out to have dinner. It can be very different things, right? Yeah. But I think it's also about navigating this a little bit more in terms of what are the things that we can start to do that helps you to feel better, right? So it may not be exactly the same as it used to be, but maybe right now, for example, if you cannot do a 1 hour yoga session, is it possible to do a 10-minute yoga session, right? If you're not able to do the hobbies that you used to do for whatever reason, is it because you've lost the interest? And then I may be a little bit more concerned if you're losing interest in the things that you've done. But sometimes I think having a baby also gives us priorities, right? It helps us to actually rethink our priorities and what do we really want for ourselves, whether it's in terms of career or that sense of purpose, right? Maybe pre having baby, career was something that's very, very important for you. But maybe actually once you have baby, you would like to spend a little bit more time with baby, and that's okay. Yeah, and I go back to again that balance for yourself, right? What do you want? It is okay to spend time with baby and want to be there for baby, but it's also important to do the things that matter for you. Maybe it changes a little, but maybe we can navigate that in terms of what's comfortable for you at this point in time, if that helps on.
Yeah, I think this involves a lot of rediscovery, of
Yes.
yourself and also of this new reality that now you have to live through. That was very interesting. Thanks, Punita. Thank you
Thank
so
you.
much, everyone, for asking your questions. And thanks again, Punita, for your really insightful answers.
You're
Uh,
welcome.
yeah, before we wrap up, I would like to quickly present my screen again. So, we would love to invite all of you to our next AMA, which is on June 26th at the same time, 1 p.m. SGT. Our professional counselor, Glenn, will discuss how to manage conflicts in a relationship. We have limited seats for this one, so please feel free to scan the QR code at the bottom left that you can see on the screen, and you can register for your free tickets right away. We also have one final slide coming up about the feedback form, so please stay tuned until then. I'll leave the slide here for just a second to let everyone quickly scan it. Thank you everyone for joining us. We hope today's session gave you some helpful insights on managing postpartum blues. Now, we'd love to hear from you. Please take a moment of your time to scan the QR code on the screen or click the link in the chat and fill out the feedback form. Let us know what you thought of the session and how we can improve our future AMA webinars. Thanks again for spending your afternoon with us. We truly appreciate your time and look forward to seeing you again at our next event.